Welcome to This Explainer. I'm so glad you're joining us today because we're tackling what is, without a doubt, the single biggest, most overwhelming barrier to addiction treatment, the cost. Look, if you or a loved one are seeking help right now, you're probably already dealing with a massive amount of emotional stress. The absolute last thing you need is financial panic piled on top of it. So today, we're going to completely demystify rehab costs in Los Angeles. We're turning on the lights, looking at the actual numbers, and handing you a clear, totally transparent financial roadmap to recovery. Let's get into it. Can I actually afford rehab? It's the very first thing most people type into a search engine. And honestly, it's the question keeping families up at night. I want to validate that anxiety right now. It is completely normal to be terrified of that price tag. But I also want to reassure you right out of the gate. Quality addiction treatment is much, much more financially accessible than you probably assume. And by the end of our time together today, you're going to see exactly why.
Okay, let's dive into this roadmap. We'll start with the cost of treatment, then break down the actual numbers, go over your insurance rights, navigate your coverage, and finally, talk about taking that crucial next step.
Starting right off with Section 1, the cost of treatment and understanding the continuum of care.
People often think of rehab as just one single product with one massive price tag, but it's actually a continuum of care. As the source material points out so perfectly, for many families, cost is the very first barrier they encounter when trying to access addiction treatment. Hitting this financial wall, it's incredibly common, but by understanding this continuum, we can absolutely tear that barrier down together.
Moving into Section 2, we're breaking down the numbers. Let's look at actual LA rehab prices for 2026.
Now, what's really interesting here is how clearly the intensity of clinical care connects directly to the cost. At the highest level, you have medical detox. This is the most intense because it literally requires constant, around-the-clock medical oversight to prevent severe withdrawal complications. That'll run you about $1,500 to $5,000 a day. Once a patient is stabilized, they generally move to residential care. Think of this as your standard 30-day live-in program, ranging from $10,000 to $50,000 total. Finally, as patients transition back into their daily lives, they step down to intensive outpatient, or IOP. Since you're only going 3 to 5 days a week for a few hours, the cost drops way down to between $3,000 and $10,000 a month.
Now, you might be wondering about that massive gap in the residential pricing I just mentioned. Let's clear that up for sure. A standard, highly accredited 30-day residential program usually lands in the $10,000 to $25,000 range. So what about those programs pushing $30,000, $50,000, or even $80,000 plus? Well, those are luxury programs. But here's the absolute critical takeaway for you. Higher price, luxury amenities like gourmet private chefs or sweeping ocean views, they do not equate to proportionally better clinical outcomes. Your focus should always be on licensed staff and solid, evidence-based clinical infrastructure, not the thread count of your bed sheets.
Which brings us to Section 3, your insurance rights and the MHPAEA legal shield.
So the really crucial point here is understanding a law passed in 2008 called MHPAEA. That's the Mental Health Parity and Addiction Equity Act. Basically, this law requires parity. It legally mandates that insurance plans have to cover mental health and substance use disorder treatment at the exact same level as standard medical and surgical care. It totally empowers you, because it means the law legally views addiction treatment exactly the same way it views a physical medical hospitalization. Let's put this in the plainest terms possible. If your insurance plan covers you going to the hospital for a broken leg or a heart condition, it legally must cover medically necessary addiction treatment. Period. No way around it. And if an insurance company tries to deny you that right, violations of this parity law can actually be contested right through your state insurance commissioner. Your right to get treatment is firmly protected by federal law.
All right, let's head into Section 4, navigating your coverage and the whole in-network versus out-of-network debate.
Now, there's a massive misconception out there when it comes to insurance networks. Lots of quality facilities in LA operate out of network, and naturally people hear out of network and immediately panic, assuming they have to pay 100% in cash. But that's just false. While in-network means the facility has a pre-negotiated rate, out-of-network simply means you might have a higher deductible and maybe a 20 to 40% co-insurance. But here's the thing, your policy may still cover a huge chunk of that bill. Paying 20% of your treatment cost is a radically different financial reality than paying the entire shebang straight out of pocket. So when you do pick up the phone to call your insurance provider, you really need a strategy. Consider this your highly actionable checklist. You want to ask these exact 5 questions. Does my plan cover inpatient or residential treatment? What are my specific deductibles for both in and out of network? What's my co-insurance amount after that deductible is actually met? Is prior authorization required before I can be admitted? And finally, is there a limit on the number of covered days per calendar year? Nailing down these exact answers just removes all the financial guesswork.
Now, if the idea of calling your insurance company and drilling them with a bunch of technical questions sounds completely overwhelming right now, I have some incredible news for you. 5 to 10. That is the number of minutes it takes dedicated admissions teams, like the folks over at iRely Recovery, to verify your insurance benefits for you. Literally, from the very first phone call, that heavy administrative burden is lifted right off your shoulders, giving you some massive, immediate relief.
And that leads us perfectly into Section 5, taking the next step and same-day admissions.
The reality is, the window of willingness in addiction recovery is incredibly brief, and it's super fragile. When someone finally reaches that point and says, "I need help," waiting weeks for paperwork to clear simply isn't an option. Honestly, administrative delays can cost lives. That's exactly why facilities like iRely Recovery prioritize same-day admissions. They get that readiness for treatment isn't always some neatly scheduled event on a calendar. When you are ready, they're ready. Let's see how this all builds into a completely frictionless blueprint for getting help right now. Step 1. You make the call to a facility like iRely at 818-262-3537. Step 2, you get your insurance verified in just 5 to 10 minutes with totally transparent cost communication and zero hidden fees. Step 3, if you qualify, you begin your same-day, highly accredited ASAM Level 3.5 treatment. It really is that direct.
Well, we've reached the end of our roadmap today, and I want to leave you with one absolutely vital, thought-provoking question. If cost is no longer a hidden barrier, what's holding you back from making the call today? Even if private insurance isn't an option for you, please remember there are alternative pathways out there, like employee assistance programs, health savings accounts, and state-funded DHCS programs in California. The financial avenues are there. The legal protections, they're there too. You now have the knowledge you need. The only thing left to do is take action. Empower yourself, make the call, and start that journey to recovery today. Thanks so much for joining me on this explainer, and take care of yourselves.